Okay, so good evening, good afternoon, good everything, depending on what time you catch this recording. So, my name is Cheryl Albright. I am the occupational therapist on Yoga for Scleroderma team. And today I thought we would talk about sleep. This is a big one. You don't function when you don't sleep. So, I would like to invite rest and digest in and see what happens. So, my suggestion is to get in a comfortable position and whatever that looks like for you. If you're going to lay down, if you have GERD, please use a wedge. If you're going to stay seated, maybe get some support either on the back of a chair. And if you can't find a wedge and you want to lay down, my suggestion is laying on your left side so we keep our stomach acids where they belong. And this could be one of the reasons that sleep is being interrupted. But there's a plethora of other things. Our minds like to be very busy. And our folks with scleroderma have a collection of ologists that they have to check in with on a regular basis, not just the primary care, but there could be pulmonologists and cardiologists and podiatrists and rheumatologists and all of the things. And we all know running around two doctors can be super stressful. And the night before a doctor's appointment, you may not be able to sleep because you're worried about whatever test they have recommended. So I thought today we would just do a nice relaxation and invite rest and digest to come in. So once you get yourself settled in that whatever relaxation position you've chose to do today, disclaimer, please do not do this while you're driving. Focus on your breathing. Not change it. Just focus on what it's doing right now. Is it fast or slow? Deep, shallow? Maybe you can't really feel it at all. That's okay too. And you're just going to follow your breath for a couple cycles as you breathe in and you breathe out. We'll do a quick body scan. Let's see if we can eliminate some tension. Starting at your feet. If you need to wiggle your toes to bring some awareness down, you may do so. Maybe you curl your toes and relax them. Continue up the ankles. Maybe move them around in a circle, both clockwise and counterclockwise. Continue up the leg. Your shins and your calves. If you need to feel it, you can flex and extend your feet. Move them up and down. Continue up to your knees. The hinge joint, so it's only going to flex and extend. But try to envision all of the muscles and tendons that either originate or insert here. Continue up the leg. Thighs and those hamstrings. Those guys like to stay tight. So we're in chronic states of stress. It's one way to stabilize the pelvis. So those hamstrings, they like to stay tight just in case. But we don't need them right now. So try to take a couple breaths, and on your exhales, see if you can get them to relax even more. Continue up the leg to those hips. These guys like to be tight too. So maybe you rotate them a little bit, bringing your foot out and bringing it in. Try to convince them they're not needed right now with your exhales and get them to relax. Bring your awareness to your diaphragm or your belly as you breathe in and out. Maybe you notice that you can breathe a little bit deeper now. And continue that awareness to your rib cage. And between each rib, there's a little muscle that helps you expand and contract. And it might be a slight movement or no movement at all. And if they're not moving, envision them. Use your sense of vision. Visualize the expansion and contraction. Bring your awareness to your heart beating in your chest. Is it going fast or slow? And see if you're on your next exhale, you can convince it to slow down a beat or two. And continue that awareness up to your neck and your shoulders. This place where people carry a lot of tension. See if on your exhale you can bring those shoulders down, even if it's just a fraction of an inch. Feel the shoulder blades come down, moving away from your ears. And as those muscles can relax in the back of your neck, all those vertebrae, the nerves that come out at the bottom, control the hands. Release tension in the neck. See 5, 6, 7, and 8. Maybe you can leave some pressure there. So see if you can relax your upper arms, your elbows, wrists, and fingers. Bring the awareness up to the muscles of your face. Can you relax or unwrinkle your forehead? Let your eyes soften. Let your tongue fall where it's going to fall. And then the awareness to your entire spine, starting from your tailbone all the way up to the base of our skull. There's little muscles that come off of those bones. See if you can picture them relaxing, starting all the way at the base. Up through the 5 lumbar vertebrae. And 12 thoracic vertebrae. It stabilizes that rib cage. And your 8 cervical. Take a moment, see if there's any areas of tension. Maybe you notice there's a little increase of saliva in your mouth. It's a good sign. Rest and digest is kicking on. And if you don't, that's okay too. Bring your awareness back to your breath. Are there any changes in how you're breathing? And we're going to stay here for a few moments. So if you notice that your brain starts to try to wander around, see if you can, 1, observe it, and 2, bring it back to I'm breathing in, I'm breathing out. And if the breath is not accessible for you today for whatever reason, use a different sense. Maybe whatever's touching your skin. Maybe you can smell something. Maybe you can visualize something to help focus your attention. And we're going to stay here for a few more minutes. Enjoy your journey. Slowly start to bring our awareness back into the room using our five senses, first with hearing. Take a breath. Move your tongue around. Wiggle those toes and fingers. Move and stretch slowly. And observe, how do you feel? And if you notice that you are feeling more relaxed, it's a good thing this is recorded. You can do it again. Convincing your brain that we're not fighting a lion sometimes can be very difficult. So the more that we can practice being awake and relaxed at the same time, the more our nervous system may not overreact to things that aren't a lion or a threat. We all have bad days, we get bad news. And hopefully, this is one way we can settle the mind. And this is one way, hopefully, we can get some peace, even if it's just temporary.